experiencing vertigo? When is your vertigo very dangerous? Vertigo can be a benign nuisance and may not be a serious medical emergency. However, it is very dangerous when it is caused or it is associated with certain underlying condition. And this is when you should be concerned. If you have a vertigo and it's accompanied by number one, severe headache, sudden severe headache, this could be a sign that you're having a brain hemorrhage or you have an aneurysm or even a stroke. So vertigo with sudden severe headache should not be taken lightly. Number two, if you have vertigo and you're experiencing double vision, slurred speech, facial weakness, or numbness, could be a sign of a stroke, especially what we call posterior circulation stroke, the back of your brain. So you should not sit home at all. Three, if you have vertigo, the room is spinning, you have difficulty walking, loss of coordination, or you have been falling down, you're walking as if you're drunk, that is very serious. It means that you have what is called a cerebellar stroke, or it could be a sign that you have a tumor. Number four, if you have vertigo, your room is spinning and you're experiencing chest pain or irregular heartbeat, that could be a serious cardiovascular problem, especially arrhythmias, something like atrial fibrillation or other form of irregular heartbeats. And you should not sit home, call 911 immediately. The next one is if you have vertigo, the room is spinning, and now you're having a hearing loss, or especially in one ear, and there's a severe ringing in your ear. This could be what we call acoustic neuroma, or it could be labyrinthitis, which sometimes can be very, very serious. Now, the last but not the least is that if you have vertigo or you have a neck pain after trauma, and all of a sudden you have vertigo, that is very, very serious. Pay attention. If you have a car accident and you have a neck pain after trauma and you develop vertigo, that is very serious. It could be a sign that you're having what we call vertebral artery dissection. This can cause a stroke. So you should go to the ER immediately. Now, there are certain things that are also concerning, but not an emergency right away. For example, if you have persistent vertigo that has lasted for days, well, you should be seen. Don't just think that this is a benign peripheral positional vertigo. It could be a sign of a stroke, and again, you should go in. Or if you have vertigo that is triggered by positional changes, well, might be what we call BPPV. All right. Also, if you have vertigo, you have migraine and have vertigo, that could be also what we call vestibular migraine. But again, the first 7 things that I listed, those are the very, very serious causes of vertigo that you should be seeing immediately. The reason I'm saying that is because I've seen patients who started having vertigo and they're staggering, their coordination was destroyed, and they couldn't come to the ER immediately, and they waited several hours. By the time they come into the ER, calling 911 would have saved their lives, and we could have been able to reverse the process. So again, if you have somebody who have experienced vertigo before and you want to share your story, I want you to share the story in the comment section of this channel so that others can also learn from it. And the next one is that I want you to subscribe to our channel, give us a like, and share this video with your friends, because this might save somebody's life. Knowing that in the 21st century, you're your own physician, and so having certain things in your portfolio will help you. Until then, Dr. Moses will see you on the next episode.